Good afternoon in Europe and Africa, and good evening in Asia and the Pacific. My name is Pascale Allotey. I am the director with the United Nations University International Institute for Global Health. A very warm welcome from UNU-IIGH in Kuala Lumpur, Malaysia, where at 11:02 p.m., the weather is a balmy 27 degrees. UNU-IIGH is the UN think tank on global health. We serve as a policy analysis and translation hub for UN member states, agencies, and programs. We run several thematic seminars and webinars that reflect the range of topics of relevance and focus to our work. The Gender and Health webinar series is our opportunity for public engagement with the work of the Gender and Health Hub. The Gender and Health Hub is a platform for collaboration, practice-based learning, and co-production of critical analyses and evidence on promoting gender equality in health. So this series hosts timely debates on how to do gender in health. We engage with practitioners, policymakers, academics, and civil society organizations to examine the conceptual foundations and the evidence for translation into policy and action. A little bit of housekeeping before we get started. Today's session will run for an hour. I turn into a pumpkin at midnight. And joining me here tonight are two very dear friends and brilliant colleagues who I will introduce shortly. We're using a webinar platform which provides one-way audio and camera, but I'd love for you to join in the conversation. So please post your questions in the question and answer box, the little box you've got there. We will run the session as a conversation rather than as a set of presentations, so your questions will be very welcome. So let's get down to business. Human rights provide the framing of our shared values: dignity, fairness, equality, respect, self-determination. They are afforded to all by virtue of being human. They are not a privilege granted by states or governments. What governments do is to take these moral principles and set the norms and standards and enact laws that ensure the behavior that upholds these rights. Our work in gender and health takes as its starting point the principle of equality, that men and women are created equal into societies where fundamental rights fall apart. And this is evident in our structures, institutions, politics, etc. And the impact is unjust and often harmful. Thirdly, we work in the context of global health, a context which is fraught with challenges and contradictions and complexities that we will not necessarily have the time to address this evening, but that will not stop my panelists my conversationalists from addressing some of these issues anyway. But what is clear is that gender equality and human rights are inextricably linked. Health programs have sought to integrate their approaches to advancing human rights and gender equality. And adopting and operationalizing this approach in the health space has resulted in some important gains, although challenges do exist. Our conversation will run through some of these challenges and take a critical look at the conceptualization and integration of human rights and gender in health, drawing on examples of where it has been done effectively and where it's failed. And now to my illustrious guests. Sofia Groskin directs the University of Southern California, USC, Institute on Inequalities in Global Health, also IIGH. She is professor of preventive medicine and chief of the Disease Prevention, Policy and Global Health Division at the Keck School of Medicine, and professor of law and preventive medicine at the Gould School of Law. Sofia has published extensively, including the first text in Health and Human Rights, several training manuals and edited journal volumes, and more than 200 articles and chapters covering a wide range of topics in global health, human rights, and social justice. She's a pioneer in bringing together multidisciplinary approaches to global health and her work ranges from global policy to the grassroots level. She has been instrumental in developing the conceptual, methodological, and empirical links between health and human rights, with a focus on HIV/AIDS, sexual and reproductive health, child and adolescent health, gender-based violence, non-communicable diseases, and I think I'll stop there because we do want to have a conversation. Rajat Khosla is the Senior Director of Research, Advocacy, and Policy at the International Secretariat of Amnesty International, based in London. He previously worked for the World Health Organization in Geneva, where he served as Human Rights Advisor from 2013 to, I've got 2020 here. Yes, it was 2020, wasn't it? Yeah. In this capacity, he led on research and normative work in the implementation of the Sustainable Development Goals, in particular on women's rights and issues related to sexual and reproductive health. He guided countries and the WHO regional offices on policy and legal analysis, and represented the organization in high-level negotiations and processes related to human rights. Rajat also led WHO's policy work on the integration of women's rights in humanitarian emergencies. In 2018 and 19, he was seconded to the office of the UN High Commissioner for Human Rights. Sofia and Rajat, thank you for joining me and welcome. So I will start off with noting that you both have had rich careers in human rights and in health, and have been in the exciting position of actually being pioneers of a lot of the work that is done in this area, making human rights real within the context of health. If I can start with you, Sofia, can you tell us a little bit about your journey and how it's influenced your particular approach to health and human rights? And by this, I also mean that, you know, the range of experiences that you've had that have brought you to your work and the position that you're in today.
Thank you, Pascale. And thanks also for inviting me to do this. It's a pleasure to be here and to be with you both and to be with everybody here in this conversation. I guess I need to start with the fact that I was an idealistic college student and I had this idea that I wanted to change the world. So amongst other things, I was studying gender and status and doctor-patient relationships as part of my undergraduate major in sociology. And so I was already kind of interested on the intellectual side, but then on the personal side, I had a long-term boyfriend at the time and we were sexually active. And I don't think either of you know the story, but as luck would have it, I ended up with a cyst on my ovary that ruptured during that time. And the doctor that I saw at the clinic that I'd gone to, because I was incredibly scared about what was happening with my body, rather than being supportive, called me an animal. And he called me an animal for being sexually active. And he proceeded to insult me even as he was treating me. And I was personally outraged, but I was also struck with the power he represented. I had to be in his good graces in order to be taken care of. And there was incredible injustice between his behavior and his words. And I realized I was kind of living what I was studying. And so that was a key slice. Can I tell one more story?
Please go ahead.
One more story. Since Rajat is now with Amnesty, I have to tell my Amnesty story. So I am from California, and I was a volunteer with Amnesty International, and I moved to San Francisco with this idea that I was going to be doing sound and lights for music. Okay, that was my dream. But I got a job as a paralegal to pay the bills. And with that job, I kind of fell in love with the law and the potential of law to make legal change, which could have positive effects, not just for one person, but if you could get the right laws in place, that you could make real change. And it was the early 80s, and I was living with the devastating effects of HIV kind of all around. And I was really struck here with the fact that folks were dying, but the law was incredibly unjust. And in some cases, it wouldn't let two men not just inherit from each other, but even sometimes be together as one of them was dying. And it was really an outrage, and it was the law. And I saw in a very real way the harm that bad law could do right here in my own space. And I decided I had to go to law school. And so I forewent my music techie dream, although I still have it, and started to engage with the injustices happening in the name of HIV in countries around the world. Things like people being prohibited from traveling, from getting married, being criminalized for being sick. And again, I was really struck with how much law could hurt people. And with some friends who are still friends to this day that you all know, Allie Miller, Cynthia Rothschild, Meg Satterthwaite, we tried to get Amnesty to pay attention and to pay attention to these issues. But, and Rajat, I'm not holding you personally responsible for this. They said that health issues were outside their mandate. And working together, we managed to get the policy changed. And as we all know, Amnesty and other human rights organizations now see and work with these health issues as a human rights concern. So that was a real success. And I think that's kind of, those were kind of important spaces kind of launching me into this place.
Great, thank you. And just so in case we can pull them out again, I really want to draw on the ultimately about the need to make a difference and the steps that were needed to be able to support change. Rajat, same question, please. A little bit about your journey and how it's influenced your particular approach to health and human rights.
Thanks, Pascale. I think some somewhat very similar starting points. I have to say, in the sense of the idealistic part of it, and that the need to do something to make a difference. And have to say, and being thoroughly bored with the law program that I was in while studying law in Delhi. And one thing that I was increasingly drawn to in the initial years of my education was understanding the relationship between law and poverty. And I think if I was to trace back my entry points to work around social justice, which later became and transformed into health and human rights, is about understanding the relationship between law and poverty, and as to how law as a driver and in some cases perpetuating inequalities and driving people into impoverishment, and how impoverishment then automatically subjected certain categories of people to the harsher ends of the law, and what that relationship meant, and how it was manifesting itself and growing up in Delhi in those times, and seeing that intersection play from a variety of perspectives, from beggary and destitution to some to certain contexts, to aspects that related to denial of access to certain basic services, and in other areas. And so those were the kind of, the first signposts for me in terms of understanding how issues of social justice were playing out and what was happening. The second was in terms of coming towards the final bits of my law education, but as I entered into a career in law, and the glorious 3 years I spent working on litigation issues in India, was working on social action litigation, and what in Indian context is often described as public interest litigation. And these were the early years where the judiciary was coming out as ones that were holding the torchlight on fundamental rights, and interpreting the Constitution in a certain manner that was reading the fundamental rights provisions, Article 21 of the Indian Constitution, which is to right to life, to interpret it to mean that you cannot fulfill the right to life if you did not have certain basic guarantees included in it. And I had the privilege in those years to look at certain litigation, and one of them, which was on health, but there were others that I was working on, one of them regarding the compensation for the Bhopal gas victims, the another one in context of manual scavenging in India, and a few others that I was involved in those periods of time, which made me further foray into issues around social justice, economic and social rights, and increasingly on health dimensions, but health more in terms of health protection, not as health as fulfillment. And I think the third signpost I wanted to mention is is the time I spent when I was actually doing my master's program in England. And the importance of that was not so much the master's program that I did in England, but the person I started to work with, which was Paul Hunt, and who was around about then appointed as the first UN Special Rapporteur on Right to Health. And this was fundamental, not because I was working with Paul Hunt in those days, but because the UN was making a giant leap in the work on economic and social rights as well. In 2000, the first ever special rapporteur on these issues were appointed, somebody that Sofia worked very closely with, Katerina Tomaszewski, on education. And then in the year 2002, the mandates were created on health and housing, and Paul was appointed as the first one, and I happened to be there, and started working with him initially as an intern, but then joined the team as a researcher and a faculty at the university later on. And I think what is important for those days was that what we were doing was, in a way, unpacking the normative foundations of what it meant when you said health is a human right in itself, and what the intersection between health and human rights was all about. And it isn't about semantics. It isn't when we say health and human rights, what is it that we are trying to say? The interrelationship, which is so critical, was not very obvious. The work of Jonathan Mann, Sofia Gruskin, and others, that was in the reckoning for us to draw upon the legacy of the HIV movement that predated this, the FXP Center that was set up, brought us to the recollection about how do you then articulate right to health as itself, and what it meant, and what were the underpinnings of it. And then I think that started unpacking of different elements of it, the social determinants dimensions of it, the drivers of it, the role of non-state actors and their influence on health as a human right, what we are now recognizing in terms of the role of pharmaceutical companies, therefore. So I think that, to me, in a way, crystallized and sealed my interest forever on health and human rights and my journey, which then continued into other organizations and interests. But just to stop there, but with the fact that I think the way the decades of 1990s, particularly, and the normative unpacking that started to happen around about the mid-90s with the UN's general comments, the special procedures, the formation of the FXP Center, etc., and how it forayed into a greater deepening of our understanding of what we understand today of health and human rights. And I was the fly on the wall in those days of all that.
Great. Thank you again. Just to emphasize that a clear message that comes out from both of you comes from the recognition of the law as being unjust, and then going into the law to change, to see how the changes could be made. Again, an important point that I'd like to stress for us and our work in terms of making change. This, ultimately, it's not just about understanding and talking about, it's really then picking up how change has happened. Just before, yes.
Pascale,
yeah,
yes. Can I just say something on this? I think what you're seeing is we're both a little bit like lapsed lawyers, right? I mean, in the sense that it's a bit about, I think I know for myself, I'm driven by the impacts of law on health. Okay. As opposed to just being a law person. And so I think it's kind of, you're right, like we were both kind of in that space. Rajat,
but it's not just about the impact of law on health, it is also using the law to promote health as well in your in the body of work. Yeah. Okay, so just before I move on to the next question that I have, can I remind participants as well that you can join this conversation? All you have to do is to type your questions into the question and answer box, and I will interject them with the conversation. The next thing that I want to ask is for us and motivating this webinar series, we have chosen to use gender as an entry point to address a range of global health challenges, essentially with the aim of tackling inequalities and inequity particularly. There have been and continue to be discussions about human rights as instrumental to this agenda, or more central or integrated. So that we would be addressing gender, equity, and rights as an integrated package, for instance. What would be your position on this, and why? Does it make sense in terms of the practical application, and getting the health outcomes that we seek? What's your position on this, Sofia?
Oh, am I going first?
You're going.
Rajat, you should go first at some point. I'll go first on this. So, I mean, I don't think it's a zero-sum game. I mean, I think each entry point offers something, and I think bringing them together is hugely important. I do think if we're talking about complicated issues, I think equity is the one that's the most squishy, and it's interesting because I think that for me, and I think I can't see a single place where thinking about the three together would not be useful. But I am really conscious that different people mean different things when they say gender, or they say rights, or they say equity, and that it's about clarity around the definitions. I think that the synergies are really strong, but it's also a question about what are we using it for? And in many ways, just to speak for rights for a moment, I think that the advocacy language that's possible with human rights to get to people's attention is really important. And it's really something that I think speaks strongly. I think there's also the part that it brings forward this idea of the law and legal standards, and the idea that we can hold states or other duty bearers to account. And I think that piece of it, of the law, that adds into that kind of brick triangle of these three pieces together. And I think that there's really about bringing rights, gender, and equity in terms of how we do our research, or how we do the kinds of public health interventions that are there. I have a real concern that often we end up kind of competing against one another. And I think that it's about how those pieces need to come together, so that we're not kind of looking at them as distinct, but thinking about ultimately kind of the work we're trying to do towards a healthier society. And I guess there's a complexity to trying to do this because there are different disciplinary frameworks that different people are more comfortable with, also because of their training. And so often in public health, there is less training on some of these, even with people that are moving towards social justice in terms of what they're doing. So I guess I'll stop there. But I might have something more to contribute. Rajat?
Before I come to Rajat, there is a question that has come up that relates directly to what you've to your intervention, Sofia. Letitia says, health is a human right. Health is a human right because it is part of the human condition, but we can't have a right to health. We have a right to the conditions and services that allow us to stay in good health. I take it that is consistent with what you're saying as well, right?
Yeah, I think that it's the right to the highest attainable standard, and it's recognizing that the highest attainable is something that we all need to be striving towards. I think it's incredibly important that we're all moving towards that highest attainable standard. And it comes back to almost the advocacy piece of using rights language and how helpful that can be in that way. But it also gives us a legal normative hook to be able to attach to.
Great, thank you. Rajat, please.
Thanks, Pascale. Let me take the last bit first, because I think that just to build upon Sofia what's said, and there's a fascinating sentence in the opening paragraphs of General Comment 14 which actually clarifies it beautifully. It's that the right to health is not a right to be healthy. That cannot be determined by anyone. But what it is a right is to have the set of interventions, the access to programs, health services, but also the underlying determinants of health, which will make sure that an individual is able to fulfill their right to the highest attainable standard of. And I think that is an incredibly important, and it isn't that we are splitting semantics here, but I think there is a merit in terms of the wording there, which is equally important, because what we are then talking about is not a constant, but something that involves is dynamic, that needs to be situated within the context that we are talking about as well. Going to your original question, Pascale, is this looking at it from a gender equity and human rights perspective, I think a couple of things to say. One is that I think what is imperative is for us to look beyond the chapeau of what we mean by that. I think the labeling might be very useful in terms of an organizational programmatic construct as such, but what and you and I have had this conversation in the past as well, is that where I think things start becoming a little bit difficult is that when we try and force a theory of change where it doesn't exist. And think these three are very distinct core principles that must be appreciated as an of themselves. And then I think that, to me, is the first point to make. I think what is it that we gain from each of them individually as core concepts in global health is where the emphasis needs to lie. The second is that while we look at health equity, to me, therefore, is an outcome of how we actually aspire and address issues around gender inequalities and human rights violations that impair an individual's ability to arise. So I think there is that cyclical relationship almost between the three, but I think the independent value that the three of them bring into some of these things is equally important, that we must recognize. Because as Sofia was trying to explain, if you look at it from a human rights perspective, and to me, the first and foremost human rights is gender equality. I think I start from there. And if I start describing the key principles of a rights-based approach, to me, inequalities, equality and non-discrimination comes at the top. So if you go from there, then what are the key issues that we look at when we are looking at health and human rights? To me, if I come from a gender perspective, what it becomes imperative is to address issues around power and privilege and hierarchies that impair and subject people belonging to different genders to different health outcomes. And what are those root causes that are feeding into that? What are the human rights violations that are resulting into individuals belonging to different genders having different health outcomes and exposures as such? And therefore, for me, the theory that lies, and I think the red thread, if you may, that underpins all the three elements that you talk about is that of the idea of justice, which we often do not capture it very well when we look at these things, in a carte blanche manner, as we often tend to. And if you do come in from a justice perspective, then issues around gender inequalities, human rights, ensuring that we are addressing inequalities or inequities and the stratifiers become almost as a core components on how we aim to achieve social justice in its first place. And I think we do need to underpin that discussion so that we do not lose the emphasis around power. We don't undermine the role that law plays, but at the same time, we have the sight of what we are trying to achieve is social justice overall. And then the last point what I wanted to make is, and this is where going beyond the chapeau is important, is then what we need to identify is what are the different tactics and strategies that we need to use, which are equally important but very distinct in certain areas, and how we actually effect the change that health equity asks us to achieve for. So maybe I stop there now, but can come back further.
Great, thank you. Sofia, did you want to comment further on?
Sure. Sure.
Go for it.
Since we're having a dialogue, let's have a dialogue. So I really agree on the point about tactics and about, and actually I agree with everything you said. Unfortunately, I agree with everything you said. So, but one of the things that I think is complicated about justice as a framework is that while I agree that that's what we're going towards, I think we may have different definitions of what that means. And I think that what's useful about human rights is that it gives us a legal normative standard for how we think about this in ways that I think is really important. And then I also wanted to ask you in terms of equity, because I've had the most complicated relationship with equity of these concepts, right? That's a complicated relationship for me, and it's interesting because for me, you said equity is about the outcome, and for me, equity is about the process. And I to get to equality, but I'm not sure I'm right in that. I struggle with that piece of it. So I just kind of wanted, Rajat, if you could say a little bit more about that so that we could, since we're having a dialogue.
May I, Pascale?
You may, please.
Thank you. I know this is very funny because Sofia's paper with Paula Brevman remains one of the best written papers on the account of the difference between equity and inequality. So I'm fascinating with the question. I agree, Sofia. I think it is both about the outcome and about the process. And I think the 1970s Tanahashi framework, in my mind, puts it very clearly, which is in a way origin to a lot what we use as the AAAQ, as you know. So it is making it imperative to not only look at the outcomes, but the pathways to achieve those outcomes as well. And how do we address those stratifiers of inequality? And this is where I think the report of the Commission on Social Determinants of Health and a lot of work that went into that becomes important. But what I think the problematic starts to happen is when we start juxtaposing equity with equality and pretend that it means the same thing, whereas the distinction is very strong and stark. So I think this is where, for me, the tension lies, is when the terms are being presented and used in a loose enough manner to say, well, it's the same, but it isn't the same. And then I think this is where the pathways to achieve and what the outcome is equally important, and to narrow it down. And I think this is where the human rights framework becomes the inherent linchpin, if you may, in terms of achievement of that health equity overall. And so for me, that's how I usually have looked at the relationship, both from a conceptual perspective, but if you then look at it from a programmatic perspective, and if you look at, to contextualize it a little bit, if you look at health inequities in context of indigenous populations, and then you look at what are the kind of pathways that are needed to address the kind of divides. The social justice report from Australia in early 2000s is a very good example, because the interventions that you are looking at are the human rights interventions to get there. So I think that's how I would look at it. So not so much of a disagreement, but I think it's just quoting your own paper back.
And
can I?
Yes, go ahead.
No, just to say, I 100% agree with you. And I think what's interesting is, to quote that paper back, is that as time has evolved, my thinking has gotten more complex, and I've gotten, if I could rethink that a little bit, there are more, the nuances you're talking about I think would be in that paper if it was written today.
Okay, there's the challenge for you. Can you please revisit that paper and do an update on it? And you made the commitment on air at the webinar. Can I, before I move on, you both raised, or Rajat raised and Sofia agreed with, the specific focus on what are the tactics and strategies. Can you expand on that a little bit? Please, Rajat, starting with you, because you tabled it.
There are a variety of things, and I think best might be useful is to look at it from a particular example perspective. I think there is a lot if you look at it in terms of, for instance, looking at violence against women, as an example, on the sort of issues that, if you are looking at it and as a gender equality as a prism, and looking at violence against women as a particular thing, the kind of tactics that you need to look at is the tactics that help address issues around gender norms, masculinity, community level interventions that will help address. And there is a lot of evidence, papers that have been written by people like Allotey and others, which point in that direction on what is needed and where we are on some of these issues and challenges that need to be addressed. And so unless we tackle some of those issues from a perspective of power and addressing issues around masculinity, male involvement, and in terms of ideas around gender norms, we do not see the kind of impact that is needed in terms of having the change that is needed. Looking at issues in terms of what we need to address from, if you look at the same stuff, what we need to address coming in from a human rights perspective, it's not that distinct, I think. But what we do then bring in is issues and emphasis around issues around law. How are justice systems and mechanisms that are dealing? Are women having access to the comprehensive post-rape care services in the countries that there are? Are there impediments? Is the state criminalizing access to certain services? How do we deal with that? Issues around accountability and what kind of remedies and redress mechanisms are available, not available. So I think this is where, when you do cascade them down from that perspective, you do get the level of granularity of the kind of interventions and tactics that you are looking at. And then you look at a more comprehensive programmatic work on how do you effect the change between the different contexts that we are speaking about.
Great. Sofia, did you want to comment further on that as well? You're muted.
And I'm much more interesting when I'm muted, but yes. I think that one of the things, I 100% agree, so I don't have much to add. The only thing I would add in terms of the rights piece of this is that there's incredible power to being able to say the right to this or the right to that. The right to something makes a real difference as a tactic to be able to try to move communities, to be able to move institutions of power. And I think that that's a piece of a tactic that I would just want to add to the discussion.
Great, thank you. I'll take a question and then we can go back to the others. There's a question from Alexandra Solomon. The gender equality discourse in global health is permeated with language that reinforces gender binary. Equality between men and women is the UN definition. How can we accelerate progress towards queer rights to health and codify them when the international human rights instruments are inherently exclusionary? The language is weaponized by states to limit meaningful progress, and so on. Starting with Sofia, because I know you're working particularly in this area.
Sure. So first of all, I totally agree with the concern. And so just to start from there, and I think it comes back to thinking about tactics, actually. And it comes back to thinking about what is the way to move things forward. And I think one of the things that, as a strategy, one of the things that's important is the change to the International Classification of Diseases around transgender population and moving transgender phenomena outside of a mental and behavioral disorder chapter into a sexual health chapter. Why that matters? That matters because it's a technical change from a health organization. That then can then translate to legal change. And so one of the things that then becomes important is to recognize how you can work with, from a tactical perspective, a technical change in health to be able to move the human rights mechanisms, to be able to better engage and to move a conversation. Because again, I think one of the issues around the binary as well is the language of gender isn't so much in the human rights initial kind of historical discourse. It's more the language of sex, which narrows very much where you go. And I think that there is a strong 5-year strategy right now to be able to think about how we move and use what happened with the ICD for everyone, to be able to move us out of the binary into a broader framework that is useful for all of us in terms of recognizing that we're all kind of within that space, and that the binary framework doesn't work for anyone. And I guess the last thing I'll say, just in terms of thinking about this, is what we need to be clear about is what's the outcome we're going towards, and what is it that we're trying to move towards. And I think what is important is to recognize coming again to the point about where is rights relevant, where is gender relevant, this is where the gender framework may be most helpful to help us move forward.
Great, thank you. Rajat?
No, totally. And yeah, I think very much agreeing with what Sofia said. And I think this is where both the tensions and the fault lines between the two frameworks become more obvious. And as somebody just commented in the chat as well, although I wouldn't say it's all idealistic, but I think there is a lot of actually rigorous intervention models that have been put forward on some of these things. But the challenge is what Pascale, you were saying, is that there is a lot of weaponization of terminology which has happened and increasingly happened over the last, I would say, 5 to 7 years as we look at how these issues are being framed and presented. And unfortunately, most people are honing in is on the binaries of it rather than what we need to achieve and what the outcome is that we are aspiring towards. What I find increasingly difficult, and at least within the UN level, is that how the conversation around gender has become increasingly more reductionist rather than progressive in its construct. We are increasingly talking about conversations of gender from an exclusionary perspective rather than an inclusionary one. And to me, this is where human rights can add value further. And I think what is happening in terms of the human rights conversations on how we are looking at issues around sexual rights, issues in that regard, have got a lot in the making on how we could understand and unpack issues around non-binaries, but also I think what we do need to understand and unpack, and this is where, how rights are being applied in other institutions from an operational perspective, how rights are being used within institutions like WHO in terms of UNFPA and elsewhere, in terms of the programmatic work is equally important. How are we situating the health-specific needs and conditions of the different gender identities and sexual orientation? And we are not doing that. So we are still looking at it when we are defining our health interventions from a very binary perspective, rather than capturing the needs and aspirations that individuals belonging to different genders would have.
Great. So then from a rights perspective, what would you suggest 2 priority areas for research that could be game changing? Pick, decide what level you want to pitch it at, whether it's at the systems level or the policy level or the politics level. What should we be doing with a gender hub that is using gender as an entry point into global health challenges? What should we be looking at? Rajat.
I was drawing up a list. I thought we were going to do a proper Delphi exercise there and start circulating.
Well, send us the list afterwards. It will be most helpful. But yes, kick off with 2. We might grow the list afterwards.
Well, funny enough, actually, Sofia and I worked on a paper, I think it was 2016 or 17 together, which looked at what are some of the gender and rights research foci that we need to look at, and I think we need to re-look at and probably revise some of that because we didn't quite landed on research questions. I think we were challenged to define even the research foci and what they would look like. I think I'll put 2 as a start. My first one is looking at human rights, health and human rights from a policy making perspective. And let me explain what I mean there. I think what I would want to look at is the impact of national level politics and ruling ideologies on how issues related to health and human rights are manifested in policy and programming issues. We have had some inkling of that in the last, say, 4 to 5 years on the impact that it is having in terms of the national level politics and ruling ideologies on how programming and policy making is taking place. And what is starting to emerge is that there is both issues around palatability on certain human rights being more equal than other human rights. So while we will talk about, say, family planning, we'll not talk about abortion. While we will talk about reproductive rights, we'll not talk about sexual rights. While we'll talk about women's rights, we'll not talk about gender in the broader sense that we were just talking about, let alone anything to do with transgender, intersex issues, etc. So how is the impact of national level politics and ruling ideologies being transformed into policy making and programming? I think, to me, that we haven't quite understood. We talk about politics and its impact in a rhetorical fashion. We don't know how it's working and where the fault lines are and what we need to do in terms of addressing some of those issues. The second is the impact of social movements on how agenda setting is happening. And then I think this, to me, remains one of the big failures of those working in global spaces. And I think if you reflect upon the last couple of decades, is a disconnect between what is happening within the global spheres to what is happening at the local level is becoming more and more stark and distinct. And if you then rewind a bit further from where we were starting in terms of the legacy of the HIV movement, to where we are right now, we have a fundamental disconnect in terms of how we are in global health and human rights connecting with social movements, and what role social movements and their experiences is playing on how global health agenda setting processes are happening. And what do we need to do in terms of bringing that together, learning from the lessons that we have from the HIV experience, where you actually do have that localized experience on the decision-making table and helping inform the global agenda setting from that localized learning. And then I think, where is that interaction, and why is that being fizzled down and tapered off, and how do we reconnect them, and what are the interventions and the spaces that we need to bring? So to me, the role of social movements and the impact of national level politics and ruling ideologies remain, two of those issues that are increasingly becoming more and more critical for us to understand on how we do agenda setting and programming on a variety of global health issues.
Great, thank you very much, Rajat. Sophia?
Yeah, I mean, I think again, I totally agree. So I will take it to a more kind of micro level, which is just in terms of thinking about what it means to actually bring rights into doing public health research. And just to say that one of the concerns that I think we all share is that rights tends to be a before thought or an afterthought, in the sense that it just even comes in. So the idea of even being explicit about rights being part of public health research would be a start. And I would love to see agreed upon definitions of rights before research is taking place, and carried through all the way to the health outcome that's trying to be achieved, but not, and this is kind of key for me, not to see, oh, did this right make a difference, but to see how rights as part of public health work more generally can actually improve those outcomes. I think that to me is key, and we're not there yet. This is the rights work tends to be separate from rather than within, and there's many different reasons for that, which I'm happy to unpack if you want me to. But it's really just to say, I am less concerned about topic than I am concerned about actually integration, and about what it's going to take to actually do that, and to be able to make that happen. I think there is, from those who do research, I think in the public health space, I think there is a general lack of, there's a concern, let me put it that way. I think that there's a concern about whether rights are going to get in the way of the outcome that they are trying to achieve. I think there's concern about the fear of adding more work. I think there's a whole sense that it's not clear what rights can add. And so if we're able to actually do this and document it, that would be most important. And I think it would take some significant changes in how the people who fund research would need to be asking for this more explicitly. We would need to be thinking from perspective of how we write up research, what it is that journals look for. I mean, there's changes that would have to happen at a structural level. So I'm not exactly answering your question, but I feel that these are kind of key to being able to actually choose topics, if that makes sense.
Do you think the problem relates to the need in global health largely to have a measurable outcome, and that has not yet do you think that could be the problem?
I think it's because of perhaps it's because of an understanding of what a measurable outcome means. So I think that the issue is you can have a measurable outcome, and rights can be critical to being able to achieve that measurable outcome. But I think the methodologies for how that is done is not as widely known or thought about as it could be.
Okay. So we have about 5 minutes, 5 to 7 minutes. The final question. Global health institutions and the international community are quick to cite all these values. We've got beautiful documents. Other shared principles like dignity, fairness, equality, and so on are terms that are used very loosely. And in your more optimistic moments, do you see a future in which these principles are actually realized? How hopeful are you about the human rights environment, given all of the challenges that we have now, given COVID, or do we actually have an opportunity to, and I hate the expression now, to build back better within the context of rights and human rights and health and gender equality? Big question, but your thoughts, please. I'll start again with Rajat this time.
Thank you. I guess I wouldn't be doing it if I didn't believe that there was a future, right? So I think fundamentally believing it, and I think if at ever there was a doubt in our lived memories, I think that has been addressed courtesy the pandemic and the realizations and the reckoning that societies around the world have had. I think have cemented the argument of health as a human right, but also, these other shared principles that you mentioned around dignity, fairness, equality. I think if you look at in terms of the initial pandemic response, what's happening with the vaccine right now, and then how issues around inequalities, fairness are playing out, I think it is very clear where what we need to do and what needs to be on the agenda. The question is, are we listening, and are we ready to do what is needed? Unfortunately, time and again, the answer is those in power are not listening. They seem to be tone deaf to what has happened. COVID has come and taken over our imaginations. But what still remains is a world picture of disarray and greed and leadership that is playing politics with people's life, and companies that are getting richer and richer at the backs of people being driven into poverty. But also, and this is what I want to mention, is that as grave the situation with COVID has been, it is an embodiment for what has been building up for years. The shameless austerity measures, the cuts in health services and budgets, the kind of disinvestments that has happened in terms of issues related to social determinants. If you see health inequalities on its own, this was waiting to happen. And unfortunate is that the cost of it has been paid by the million plus lives that have been lost around the world as a courtesy of leadership failures. But leadership is there. I think the leadership is today of the people on the streets who are demanding change, and I think they won't be silenced. And I think unless the leaders start listening and start delivering on these principles of dignity and well-being, I think we will be still at the same places. But I think the young people on the street today and those marching and demanding for human rights, I think are the ones for where I draw the hope and aspiration from.
Excellent. Sofia.
Yeah, I mean, the same thing. I mean, I have to say, I feel like my whole life it's been a bit 2 steps forward, 1 step back, but I'm an optimist at heart. And it's about the world we want to live in. And I guess it is a question, first of all, how many times we have to keep reliving the same lessons over and over. And I think, very much echoing, I think, Rajat, what you were saying, I think there's this attention to inequality right now, not just from those who live it and already have seen it and engage with it, but it's much more in the public discourse. It's the people in power that are not listening, but there's far more people engaging. And I think there are new faces, new places, new work that is happening, but we've got to address these structural inequalities. We can't just be piecemeal about this. And I think, one of the things I feel that I need to raise is the colonialist tendencies of global health, right? Something that I'm acutely aware of sitting in a US-based research university. And I just think one of the pieces, just to add to the parts that Rajat was saying, is I think we have to acknowledge our place of privilege, all of us. The fact that we can have these conversations, and how do we work with and account for knowledge and experience while recognizing the place of privilege that happens, and how those come together is something I think we all need to grapple with if this is going to work. And I also think, yes, it's young people. I would say it's students. I mean, it's the next generation. I mean, it's the people that are moving the agenda forward, that are the people that I think we need to learn from now, and need to be thinking in terms of kind of what are these pieces. And, when I think back to getting involved in human rights initially, I mean, coming back full circle about this idea of all beings being born free and equal in dignity and rights. I still believe that. I mean, I'm as cynical as they come, but I still believe in these basic principles. And I think it's the only way that we can keep moving forward.
Great. Thank you both very much. We are out of time, unfortunately. There has been active participation from audience members. I do want to particularly shout out Letitia and Alex, who have been furiously typing into the question and answer and the chat function as well as Hannah as well, who has now integrated her questions in there. Thank you very much. I kind of feel like we're just getting started. So maybe we can take the conversation offline, but we do need to formally come to the end of the webinar. Thank you very much, Rajat and Sofia. Thank you everybody who has called in and has listened to be a part of this.